causes, okay? Because if I say causes, you see that we don't necessarily know the exact cause. But there are some factors that when they exist in a human being or in an individual, you say that yes, this woman or this person or this man stands the risk of developing what? Breast cancer. Okay. Which are these factors? Hmm? There are factors that we can say, okay, we can modify them. That is modifiable risk factors. And there are factors that you can't modify them. It's not by your making. Okay. So risk factors basically to explain for the any individual to understand is what conditions that when they exist, they put you at risk or they put you at susceptible to develop that disease. That's what we call risk factors. What are some of the risk factors? One, basically being a female, okay? Because breast cancer is more common in a woman than a man, okay? So being a female itself is a risk factor. That is one. Two, a female who gets her menses early, that we call early menarche, okay? Because breast cancer is what? Hormonal dependent, okay? You have realized that people who have a lot of influence, female hormones on them, hormonal activity is high, they are at risk of developing breast cancer. It doesn't mean that automatically they will get it, okay? So, early menarche. Normally, menarche, you talk of menarche when 13, 14, 15 years, okay? But nowadays, you see that a girl of 9 years and having her menses, 10 years having her menses, such a person has a higher risk of acquiring the disease. It doesn't mean that anybody who gets the menses at 9 will get cancer, but at least it's an alert, okay? When we go from early menarche, then we go to late menopause, okay? Late menopause, normally we talk of menopause that you stop having your menses at the age of 48 is it's a process that starts from 40 years coming, but that culminates more or less around 48, 49, 50 years. Okay? Yes. But you see somebody of 52, 53 years and is still menstruating. Such people also have higher risk than the normal person who gets a menses, stop having her menses at age 48, 49, 50 years. Okay, so that is late menopause. Okay, we have also noticed that obesity obesity is a risk factor. That is why we advise frequent exercise. Sedentary life is not so obesity is a risk factor. It's a minor risk factor. Sedentary life is a minor risk factor. The intake of alcohol, okay, even though it's not true this in among our ladies, but alcohol is also a risk factor. Tobacco smoking, another risk factor. Okay. We've also noticed that women who have never given birth, okay, a woman of 40 years, 50 years, 60, who has never given birth, such a person also stands the risk of acquiring the disease. Okay. There are other risk factors, but the most important one is what family history. We've realized there are some families that when your mother gets it, or your father, or your auntie, or your sister, you, the individual, also stand the risk. Okay, because there are hereditary factors, genes that have suffered some changes, what we call mutations. When those genes are within that family, they can transmit from father to a child or from mother to a child. Okay, so anybody who has that inheritance of that mutation has that risk. That's why you see some families tend to develop some cancers. Okay, yes. So the family history is also key. Okay, so that there are other risk factors that I'm not going to mention, but at least these are basically the risk factors. Okay, factors that when the individual has them, you say, oh, okay, such a person stands the risk of acquiring the disease.